Hey everyone, welcome to the main event. It is, what is today? Tuesday, August 22nd, 2023. So glad you guys and gals can join me today. I think it's going to be a good show. I got some interesting information from a buddy of mine. You know him, you love him, you can't live without him. Anand over at hairlosscure2020.com. Love that website. And Anand, the administrator of that site, good guy, and I really appreciate how he contributes to the show and supporting me, and of course our Friday broadcast as well. So thank you, Anand, for the content that you sent me earlier today. If you don't know who I am, what I'm doing behind this microphone in front of this camera, my name is Joe Tillman, and I am sometimes known as the original hair transplant mentor. It's a designation I was given many years ago because I was answering a lot of questions on, I think, a forum or something. Not sure. I don't remember exactly where that was. But regardless, been in the industry for over 20 years, been a hair transplant repair patient because of my first two bad hair transplant surgeries 31 years ago. God, it's getting long in the tooth there. And so for the past 8 years, I've been here on YouTube producing videos, educational videos, and also talking about doctors that have approached me about working together and where I feel like they are worth your consideration. I review these clinics using my experience, my standards, and if I think that they're worth your consideration, I let you guys know. They do pay me a monthly fee, but I'm not going to accept money from anyone I don't think is worth considering, and I've turned down a lot of money. So just getting that out of the way. So today's episode, trying to figure out how to label it. I mean, it's, do finasteride results last? And I was trying to figure out a better title, but that's what came out. It's just the way it works, especially when you're in a rush. But it's something that I get this question all the time. It's one of the more common questions I've gotten over the past 20 years. And it reflects on the comment that I've heard from so many people speaking directly to me, on the phone or face-to-face, whatever, in a consultation, or reading about reading these comments and these thoughts on Reddit, Facebook, whatever, that finasteride wears off after 5 years. I've addressed this before. I don't recall if I did a specific video to talk about this, but the idea that finasteride just wears off, that just quote unquote stops working after 5 years, is complete and utter BS. There's zero evidence to support that. Zero evidence. The idea that this could be the case, I don't know where it came from. I do know that some doctors have commented on this, such as Dr. Bob Bernstein, very respected individual in the hair restoration space. He's one of the, I don't want to call him a pioneer, but he's one of the original big thinkers about hair restoration surgery. He co-authored the first paper on FUE after he and his colleague, Dr. Rassman, lifted the idea from Dr. Ray Woods, who was the actual inventor of FUE. He just didn't call it FUE, he called it the Woods technique. Quick bit of real history there for you. But he did comment somewhere. I don't remember. I don't know where this comment came from, but I saw that he did comment saying that it can, or there's potential that it can wear off after 5 years. But then he went on to say that it could also be just that it wasn't working as well as the patient thought it was. And I find it interesting that that's not part of the quote that is included when people are talking about, I've seen people quoting the quote about what Dr. Bernstein said. My opinion is it's the latter, not the former. And it makes a lot of sense to me because I know, when you think about the general idea that doctors like to present when they talk about when you notice your hair loss, they say you don't even notice that you've lost any hair until you've already lost half of it, 50%. That's also bullshit. That's complete. No, that doesn't jive. It can be close to that, but my point with that, and I don't want to get on a side rant here, but my point with that is it can be much less than that. It can also be more than that. It depends on your hair type. It depends on the lighting conditions you find yourself in at various times during the day or night, whatever. So it's not an absolute, and in many cases, it's not even close to that. So that's something to consider. But the reality of finasteride is that if you do see that, say after 3 to 5 to 7 years, that your hair loss has actually progressed, it's not because it just suddenly started to fall out or to restart falling out. Did I say that right? My opinion and my theory on this is that it wasn't working 100%, like Dr. Bernstein said, because none of the studies say that it works 100%. It's like 70% of DHT is reduced on average based on studies, give or take. So why would anyone think that it always, for every patient that it appears to have stopped hair loss, that it has actually completely and 100%, zero questions asked, stopped hair loss? There are many cases where the loss has progressed so slowly because of finasteride, or it has slowed down so much because of finasteride. The creep of loss is almost impossible to quantify until 5-6 years have gone by, and that's when you start to notice. It's just like when your hair is growing in after a hair transplant. You get to a certain level of growth, and then you start to get, this is really common. It happened to me after my second hair transplant. You get to a certain level where it's like, is this it? 5 months or whenever. And then at 8 months, you wake up one day and it's like, holy shit, where'd all this hair come from? It didn't grow in overnight. It was always there. It's just your senses, your awareness just now caught up on it. So it's the same thing with losing your hair, albeit at a much slower rate. So I hope that made sense. And that's a segue into the actual topic. So what I was sent was an article that you can find on hairlosscure2020.com after this episode is over. Don't go there now. Stay here. And I will link to it down in the description after this broadcast. Title, Does Finasteride Work After 20 Years? That caught my attention. It's probably going to be a big article for the website. So I'll go ahead and read. Dihydrotestosterone DHT inhibitor finasteride was first approved by the U.S. FDA to treat hair loss in 1997. The original brand name from its U.S.-based manufacturer, Merck, was Propecia. Yeah, we know this. Okay. Long-term studies. Let's just jump to that. Although finasteride was approved to treat hair loss 26 years ago, that's a head shaker. There are very few studies in existence that even attempt to analyze 10-year results. It's true. In fact, I only know of one. It's extremely difficult to get hair loss sufferers to come back to the same clinic regularly for 10 years. That's absolutely true. And have their scalp analyzed. Moreover, many patients tend to stop using the drug after some years due to side effects or loss of motivation. The second one, that's a big one. Which is also due in part to the perception that it stopped working after 5 years. I know that for a fact. So let's see, where was I? Yeah, some might also alter the dosage without even consulting their physician. That's true. I've actually done that myself. Do as I do, not as I say. Many hair loss patients also add other drugs and products into the mix, which I've talked about many times. This makes it impossible to determine the exact solo impact of finasteride on their hair. That's absolutely true. That's what I preach about, people. Don't start all these medications at once. give each one time to do what they're going to do before you add something to the mix. The image on the right, actually, you know what? I should have done this. Okay, so you'll see this. I should have pulled up the image. I forgot to load that in my system, but you can see it on the website. The image on the right is from a Japanese patient who's taking finasteride for his hair loss. It shows the results at first visit, so it's a before, followed by annual follow-up visits from years 1 through 10. He's part of a long-term study of 523 Japanese patients who took 1 milligram a day of finasteride to treat their androgenic alopecia for 10 years. According to the authors of the study, quote, a high objective efficacy was demonstrated by the Modified Global Photographic Assessment Score in MGPA. It revealed improvement in prevention of disease progression by 99.1% of the 532 Japanese men with AGA treated with 1 milligram a day of finasteride for 10 years. 99.1%. That is astounding. It goes on to say, amazingly, these Japanese men have continued to see new hair growth even after 10 years of finasteride, 1 milligram a day. In fact, many patients even saw new hair growth at the 10-year mark. Furthermore, most patients saw an improvement from year 5 to 10. So this flies right in the face of that 5-year efficacy limit. The average Japanese AGA patient in this study saw an improvement of approximately 1 Norwood scale grade after 10 years of treatment. That's significant with finasteride. Side effects remained minimal even after such long-term use. He goes on to say that I'm surprised at such a high rate of success, 99.1% after 10 years. It is beyond amazing. I agree 100%. That is an amazing, amazing outcome. He goes on to say, I always assumed that the human body developed a tolerance to finasteride, just as repetitive use of antibiotics, alcohol, etc., as many people do. After 10 years of use, moreover, finasteride only reduces serum DHT levels by 70% and scalp DHT levels by 64%. Surely the other 30% keeps causing some damage to the follicles. My opinion on that is perhaps it's a concentration issue, not just a chemical issue. Like how much is in your system before it actually causes a problem. I don't know. Just ruminizing right there. Let's see. Do note, So online anecdotal reports suggest that a majority of long-term finasteride users seem dissatisfied in the long run. Perhaps the first point below explains this anomaly. Do note that these same authors published an 801-person 5-year finasteride study in 2015 that concluded that Japanese hair loss sufferers are much better responders to finasteride than are Caucasian men. That's interesting. For comparison, they cited a prior large-scale person study of 1,553 people on Caucasian men that showed a 48% improvement after 5 years. Nevertheless, Caucasian men are still great responders after 5 years. The same authors also did a 2.5-year report with 3,177 patients with similarly favorable results in Japanese men. A summary of their 2.5, 5, and 10-year results can be read at the link that he provides. In 2011, a team from Italy published a 10-year result of 1 milligram a day finasteride use in 181 men. The overall results were also quite favorable in the report, although there were some significant differences between the various age groups of patients. After 10 years, almost 70% of patients who experienced growth in their first year experienced continued growth. Moreover, in 21% of cases, treatment continued beyond 5 years, provided even better results. All the more reason not to give up on finasteride if you're seeing no side effects. So onward to the 20-year results. I hope that our Japanese friends maintain their discipline and release a 4th study with 15-year results by 2025. I doubt that we will ever see 20-year results, but I hope I'm wrong. In the Japanese effort, the drop-off in patients counted from 2.5 to 5 to 10 years is 3,177, down to 801, down to 523, respectively. At 20 years, I would not expect more than 100 people to have returned each year, even if photos are taken remotely. But based on the findings I discussed in this post, I'm encouraged to keep using my dutasteride, which is superior to finasteride and has a much longer half-life. However, I just take 0.5 mg pill every week due to fear of side effects. I also wonder if the very long-term effects of finasteride and dutasteride on estrogen and testosterone levels remain unchanged. So those are his thoughts on that. But that is very a very valuable post for people to bookmark if they ever start to question the efficacy of finasteride, whether they're taking it or not, over the long term. So, they don't have an actual outcome for a 20-year study, but they could. And like he said, he hopes that they stick to their guns and get a lot of these patients back. I think that would be fantastic. But my opinion on this is that if you're not seeing some sort of reduction of efficacy because of the body becoming used to the medication after 2.5, 5, or 10 years, which is what I've never suspected to begin with, then why would you see that after 20 years? I try to look at these things logically and objectively, and I don't see why there would be any sort of reduction of results because of the medication. If anything, when you're getting into a 20-year result, I would think that if there is some sort of degradation of result over the long term, I would consider it to be more from external factors such as senile alopecia, which is where the hair shaft itself becomes smaller in diameter as opposed to its growth cycle being reduced and further reduced over time. So there are other issues that can create the appearance of less growth or reduced efficacy that actually don't indicate actual less efficacy. So I hope that makes sense. I thought this was really interesting. I do encourage everyone to check out this article because he does have some links on there where you can see some of this information for yourself. But what do you guys think about it? Give me a call. Number's over here, 1-833-563-4247. You can give me a call and we can talk about this, but of course, we can talk about anything else that you want. Hair loss, hair restoration. If you got surgery that's booked next week or in the next couple weeks, give me a call. We can talk about it. If you got questions, you got concerns, you got fears, you're not quite sure you made the right decision, pick up the phone. Give me a call. It's toll-free in North America. Of course, you can use your calling app of choice from anywhere in the world. If you got it charged up with a few bucks, a few quid, a few euros, give me a call. We can talk about whatever you want. 1-833-563-4247. I'll look at some questions in the chat room, see what's going on. Lots of activity in the chat room. I do appreciate everyone in the chat room. And by the way, don't forget to hit the like button. This is a good episode, man. Like that, I love that article, and I love that Anand is putting out that kind of content because that's what he does. That's what his website is good for. Always appreciate that. Let's see, Reef. That makes a lot of sense. I'm now almost at year 5, and there is an ever slight creep of the hairline. It's okay, though. I am still only roughly a Norwood 2 and will keep most of my hair for years. Shedding doesn't necessarily mean you're losing your hair for good. I never stop shedding, for example, but those hairs keep growing and regrowing stronger. Awesome. I'm glad to hear that. That's good. Let's see. Lazy Lewis, you're also on oral Minox, 2.5 a day. That's interesting. 2.5, that's good. Hollow Inside 19. Joe, I heard that if you stop finasteride for a while, it might not be working again. Got a call. Hey, you're on the main event. What's your name and where are you calling from?
Joe, what's up, man? This is Joe, calling from Jersey.
What's up, Joe from Jersey? How you doing, man?
Good, I'm good. Lenny Bless in the group chat. But, what do you call it? Jose Bless. But, question. So I was thinking, we spoke a few times, and I'm on month 8 of my hair transplant, and things are progressing. I would give it so far a 7.5 out of 10.
Okay, that doesn't suck.
Not at all. Especially, definitely my hair is way healthier than it started.
Okay.
I was probably a but 1.5, 2. So just waiting on these the slower side, which is the left side, left temple to fill. Well, it's filled in at this point, but now I just want it to be a little bit more dense, which I'm hoping is going to happen within the next 5 months or so.
Mm-hmm.
So I'm cool with that.
Okay.
My question for you is so I've been on Finasteride for like the last 2 years at this point. Yeah, it's been like at least either a year and a half or 2 years at this point.
Right.
And I was curious, when do you think I was interested in oral minoxidil,
Mm-hmm.
and I wonder, should I wait until the 12 months, the 14 months of the hair transplant to start oral minoxidil, or would you consider recommend me starting it sooner than later?
You know what? That's a great question, and I'm glad you asked that. It kind of reflects back on what I was talking about earlier when I was reading that article about the 20-year efficacy of finasteride, where I mentioned, or I recalled how I'm always mentioning don't mix treatments too soon. And in your case, I consider the surgery treatment as well. So in general, I'm talking about anything that affects the way that your hair looks, feels, grows, whatever. You don't want to mix them too soon. And in your case, that would be the same advice I would give you. I'm not a doctor. I don't even play one on TV. I didn't stay at a Holiday Inn Express. All those things out of the way. The way I look at it is this. Okay, you've been on finasteride a good amount of time. That's when I would say, sure, now you can add something to the mix if you want to. But because you're still waiting for your surgical results, you're not out of the woods yet on that one. So I would wait till, I don't even like saying till month 12 anymore, because there are so many people out there that have a continued improvement past month 12. I don't subscribe to the idea that you're going to get, a huge difference at 18 months. I like saying around 14 months is your end point. Some patients may have a continued improvement in texture. If they have difficulties with the texture at 10, 12 months, it can take a year and a half for the texture to kind of settle down. But as far as all the new growth that you're going to see, 14 is probably where I'd peg that. And then that's when it's probably safe, if you want to try it, to add oral minoxidil to the mix.
Okay. I have a part two to that question.
Sure.
So I think in yesterday's episode, you had mentioned that your father, he was on oral minoxidil, something like that, and he stopped, and then he went from like a 4 to like a 6 or something like that.
Yeah.
My question for you is, since I was Norwood 1 or 2 before my hair transplant, and if I were to start,
let me stop you, Joe. Hold on a second.
Mm-hmm.
Norwood 1 or 2, that's a huge difference.
I would say 2. I would say 2.
And just for the record, there is no such thing as a Norwood 1. That's a juvenile hairline. So a Norwood 2 is the beginning. Just for everyone watching and listening, a Norwood 2 is the beginning of the chart, because that's a proper male hairline as far as an adult goes. Sounds like my friend Joe from Jersey wanted to be a little aggressive with his hairline, wanted his old design back. That's fine. I get it. How do you feel about it?
Looks good to me.
you like the shape and everything, and it looks good on you. It looks natural.
Yeah, it definitely looks natural.
Okay.
No one has been able to tell that anything. So
good for you. Sorry for the interruption, but I had to make that distinction. So continue with your part 2.
The reason why I wasn't 100% sure is because most people they should get consultations with multiple doctors to determine, before they choose one doctor, they should definitely have a consultation with multiple doctors. Mm-hmm. And depending on the doctor, they gave me a different Norwood.
Yeah.
So that's the reason why I'm not 100% sure which one I was. But,
okay.
Yeah,
so you had a doctor actually tell you you're Norwood 1?
I think it was 1.5 or 2, something like that. Can't really remember. A while.
Fair enough. All right. Okay.
So back to what we were talking about. So if I were to start it right and stop at some point, or not consistently use it, would it be more of a con than a benefit, or is it something that I'll have to if I start it, I have to do it for life in regards to oral minoxidil, or how does that work?
Well, here's the thing. I tell people that if you're going, I actually don't talk about this enough, but when people ask me this type of question, when they say, do I need to take it for life?
Because I'm still taking finasteride for life, but like I already take enough pills a day, like in regards to life. So, like,
yeah. You got your biotin, you got your vitamin C, you got your multivitamins, you got your lecithin, you got your zinc, and all these. Man, I hear you. I'm in the same boat, man.
So I'm like, I load up. Have to do this, like
I load up, but you can tell by looking at this perfect specimen in front of the camera, right? Like it's obvious. Yeah.
You're looking real good, my guy.
So it is something. If you feel like you're getting a benefit, then absolutely, you're pretty much locked in for. I don't like to say for life, but until something better comes out, which more or less is for life. The way that these things work, right? It takes forever for a new medication to come out. Like it's like the only thing that's come out that has any sort of I can't say legitimacy, but the only thing that's come out since minoxidil and finasteride / dutasteride is this Cosma RNA business, the topical, and verdict's still out on that. But it just takes forever for new medications to come out, as we've seen. So, yeah, I mean, until something better comes out, which could be 20 years from now, we don't know. But just plan on it. Plan on not ever eliminating it from your routine until something absolutely compelling comes out that could take its place. Or a cure.
Is it something that you could take like every other day? That's what I'm doing with finasteride right now. I'm taking it I take it like three times a week.
Right.
5 milligrams.
You know, I don't know if you can take it every other day that kind of way, because I think it's something to talk to your doctor about. I think that you can, but the way I look at the every other day scenario is I think it's a good idea to kind of load up for a few weeks just to get it in your system, just to get some saturation going, and then cut back down to every other day. That's just the way I look at it. That's the way I try to do things when I'm presented with that type of situation. I didn't do that with finasteride in the beginning. I did do that with dutasteride when I took that for a couple of years, and then I did do that with finasteride when I switched back. So, and it seems to have served me well, but I don't know if that'd be the case with minoxidil. Sorry?
How was your experience with dutasteride?
I got fat. Didn't notice any difference with my hair. My hair still looked, good for at the time, but I got bloated, and my diet. Now, granted, my diet wasn't, or my nutrition level wasn't then what it is now, or even a few years after that, but it wasn't terrible. I still wasn't drinking sodas and all that crap, but I was into sandwiches a lot, but it hadn't changed, and I suspect it was a water retention issue. And I didn't even notice it until I was in some videos. That was around the time I started doing video for my YouTube channel, but I was doing it for the clinic, and it's funny, man. I look at some of those videos, and no, you can't find them on my channel. I've made them private, but boy, do I look like a baby, and my hair looked ridiculous because I was doing that pompadour brush back look because my crown wasn't very strong, so it served its purpose. But I look at that and I laugh at the way I used to look. But regardless, yeah, I could see I was bloated, and I think it was water retention, which is a side effect of oral minoxidil, by the way. So be wary of that. Like watch your face. Like take pictures of your progress, not just of your hair, but maybe it's not a bad idea for people that are starting to take this for the first time to also take pictures of their face to see if they start to bloat from water retention. That is a side effect, a potential side effect. Sorry, of minoxidil.
Interesting. Thanks for that knowledge. Appreciate it.
Yeah, but as far as my hair loss or hair reversal, hair restoration from medication, dutasteride, I didn't notice anything. I can't say there wasn't any improvement, but I just didn't notice any improvement, which is the only reason why I switched. Was looking for that, and I just switched back. I switched back to Finasteride. I've been on it ever since.
Yeah, sounds good. So I'll probably give oral minoxidil a try after 12 months. Just, if anything, just for extra boost for the last 2 to whatever months of growth.
Yeah, but don't look at it as a boost for your surgical results. Look at it strictly for what it can do for your native hair, strengthening it. But at the same time, if you had so little hair loss to begin with, what is it you're hoping to do with the use of oral minoxidil if you have basically a full head of hair, assuming a full head of hair behind your transplanted zone?
I was hoping that it would give my recipient area more density.
Oh, okay. So you're looking at this to augment your surgery. Got it.
Correct.
Okay. Just a hypothetical. What if it thickens the rest of your hair to the point where any thickening it does in the surgical area, that ratio of difference still exists?
Mm-hmm. Then,
just throwing it out there. But no, in all seriousness, it's maybe could help.
Mm-hmm.
Who knows? As long as your new transplanted hairline is in the original place of your previous hairline before it thinned, then maybe some of those straggling hairs could be coaxed into coming back. Who knows? Yeah, it'd be interesting to know. It really would. So if you do try this route, keep me updated. Give me some updates on it, okay?
Speaking of updates, last time we spoke, you had convinced me to not get my second dose of PRP, so I didn't do that.
Okay.
And now that this is month 8, I just started derma stamping again. I spoke to my clinic, and they said that should be fine.
So, all right. Remind me, why did I tell you that second PRP wasn't a good idea?
You said I shouldn't be doing any of that stuff. The fact that I just got my transplant, you were like, a good transplant is a good transplant. It's gonna, you shouldn't have to like get any PRP the first year, anything like that.
Right.
You just let it heal. And if it was a good surgery, a good surgery is gonna, succeed. So
right, and I stand by that. So but it's the same thing with derma stamping. Like it's still. I wasn't talking about PRP specifically. I was talking about any other treatment being introduced into the mix while your hair transplant is still recovering or still coming in. So, it could be PRP, it could be exosomes, it could be laser, it could be minoxidil, it could be derma stamping, all these things. Because what's going on is when you derma roll, derma stamp, whatever, when you make all these tiny wounds, hair regeneration through wounding, growth factors are rushing to that area to help heal the area, and the communication between all the cells are like, okay, well, there's also maybe be some hair here, so it's reform some follicles or rejuvenate those follicles as well. But it's kicking in a new cycle. And it goes back to the original idea that if you're introducing something new, it could have some sort of negative effect, most likely a minor negative effect, but you don't want to introduce anything into the surgical area until that has actually had time to do what it's going to do. So it applied not just to the PRP, it applies to derma stamping. I would encourage you not to not to mess with that. If you have already, then that's fine. But again, just my opinion. Let the surgery do what it's going to do.
Mm-hmm.
Yeah.
Okay. Well, sounds good.
But you do you, man. Like whatever you're a smart guy. You're asking your clinic the right questions. I don't know if the answers are ideal. I wouldn't say go ahead, but that's just me.
I'll keep that in mind.
Okay.
That's what I always do.
Informed decisions, my friend.
I appreciate you, man.
My pleasure.
I'll definitely stay tuned, and I'll be in the chat. Appreciate
All right.
it.
Sounds good, buddy. Take care.
Deuces.
Bye-bye. That was a good call from Joe from Jersey. Appreciate the call, Joe. That means the line is open, 1-833-563-4247. Toll-free North America and worldwide using the calling app of your choice. I'm not a fan of adding all these new treatments, be it one treatment, be it 3 treatments after a hair transplant. Be on the treatments beforehand, the medications. I remember a clinic back in the day. They would recommend the use of topical minoxidil after a hair transplant, but only for a year. And I always thought that was weird. It's like, I understand the concept. Okay, well, it's a vasodilator, increases blood flow to the areas that are being treated, and you want blood flow for healing and all these good things that happen for the surgery, for the transplant, for the results. But then after 1 year, it just stop taking it. Well, why? Like, doesn't it stand to reason that there could be some potential new growth because of the minoxidil, not just the surgical results? And then if you stop using it, then those hairs will fall out and never come back. So, I don't know. I thought that was weird. Let's see what we got going on in the chat room. While I'm going through the chats, looking for questions, don't forget to hit the like button, people. Could really use the support. I'm trying to be back every day for you guys. It's tough because I got some errands to run. Thankfully, one place I got to go to, they're open till after 5 o'clock. So I got time to run down there. But I'd like to see the support because this is not easy to do. And I am going to try to be every day. At the very least, I will be multiple times a week. 2 or 3 times a week, but so far I'm trying to be daily. So we'll see how that works out. Let's see. Questions. Milk Drinker. Hey, Milk Drinker. Joe, do you think everyone has a different threshold for DHT for hair loss, and will it vary by area of the scalp? Probably. Yes. I think that actually makes sense because no two people are alike, and people don't generally react exactly the same to any sort of biochemical process. There's always going to be variations, thresholds, levels, ratios, concentrations, things like that. So the answer is yes. Let's see. Questions. FSK, no, not literally talk about anything. If you call, hell no. I know where you'd go. Let's see. Thoughts on oral minoxidil. We've been talking about that already, Adam B. Let's see. Jersey, hair loss meds are like death. Okay. Dutasteride raises testosterone. Okay, yes. Sorry, I'm just going through these comments looking for an actual question I can answer. Let's see. What do you think about taking Cialis for hair loss? I don't know of any. I've not seen or heard of any sort of positions by anyone, medically speaking, that can help. I think I heard something about Viagra being a potential treatment because of the way it works, also being a vasodilator of some sort, I believe. But I don't know. I don't know. I don't want to get too far into that, but I'd like to see some information if there are official statements or opinions, even studies. That'd be amazing. But I don't know. That's a tough one. Let's see. Is there any hope for young Norwood Sevens desperate for a juvenile hairline? Well, as you like to point out yesterday, John from Eugenics, he's an outlier, and I agree 100%. That's, I was saying at the beginning, and he does have a low hairline. That was created in his second pass, and according to Dr. Pradeep, he still has more in the bank. I don't know if he should use it, but that's just me. What do I know? I don't want to say no, that there's no chance, but they are slim for most people. So I hope that answers the question. Okay, to what extent are the highest rated clinics simply the ones with the best photography and video? It's a very good question. It's a very deep question that I can't get into in this. It's too deep of a rabbit hole to go down. Let's see. Yeah, I'm not really seeing any other questions. Okay, so as always, if I don't get any phone calls, I am going to wrap things up. It's currently 3:43 p.m. And guys, I started on time today. I don't get any props or recognition for that. I was on time. Like, never happens. I think maybe a 3:01, but I started at 3. Like, I fired things up at 3. Seemed to take a while for the live stream to actually catch on, but let's see here. Is there another question? Yeah. Miltricker seems to be the only one that's actually asking questions. And they're usually good questions. Very insightful questions. But yeah, this is a call and talk show, so the number's right here, right there. You can give me a call, 1-833-563-4247. I'm going to give it another minute at 3:45. It's currently 3:44 p.m. Pacific time. And if no one calls, that's fine. I'll wrap it up and try to come back tomorrow. I am going to try, I might actually have an in-studio guest sometime next month. There's a doctor that I work with that is going to be potentially in the area. And I'll be able to have him in studio where he'll be in front of me. We'll be across the table from each other, Joe Rogan style. And you guys can call in to ask this doctor questions directly. So it'll be a second time I've done this. First time was at my old studio. But I'm looking forward to that. That'll be interesting. And I'm trying to get... Well, there's one particular guest I'm trying to get that I think will blow your socks off as far as the opportunity to ask this person questions directly, and they are not a doctor. They are with a manufacturer. So we'll see if I can get that person on. And let's see, other things to look forward to. Most likely bringing another doctor on for next month, for September. So look for that announcement and video. That will be probably done and uploaded in the middle of September, because it is a process. I've been going through the process already, looking at this doctor, investigating, and there's a couple others that are on deck that are potentially coming aboard as well. And it's all for your benefit, people. Where if you like looking at doctors that I feel are worth your consideration because I feel they meet a certain standard, and because I've actually looked at them with a microscope and a jaundiced eye all at the same time, then it's good news for you guys as well. So I hope you guys are excited by that. And yeah, if you got any other requests for interviews or subjects, put them down in the comment section below. I do read the comments. Don't always respond, but I will I will check them out. And also, there have been some questions in the chat room about one-on-one consultations. I do not officially offer one-on-one consultations. I don't charge a fee for one-on-one consultations because I don't take money from patients, never have, never will, for consultations. Got to be clear on that. But if you'd like for me to look at your case, you can reach me on Instagram at Joe Tillman Official. Sorry, at Joe Tillman Official on Instagram, and follow me on Instagram. And then send me the message with. Don't ask if you can have the consultation. Just send me the photos. Just send me the photos and the information. This cuts down on back and forth and waiting and stuff like that. Just say, "Hi, Joe. I follow you on Instagram. I watched you on the main event. I think you're the best. And here are my photos. This is my background. This is what I'm considering. These are who I'm considering going to. These are their estimates for my case. This is my desired outcome. What do you think?" And I'll tell you. Maybe. Well, I'll tell you, but it may not be quick. It may not be that same day or even the next couple of days. It may take a week or two. Who knows? I've spent half the morning today, going through old messages that I had not received or had not accepted yet on Instagram. There's 40. So it took me some time. I do apologize and thank each and every one of you that have been waiting for my reply, for your patience. So appreciate that. Anyway, let's see. Any other final questions I want to get to? Let's see. Can I interview Kyle Christie? I was talking to Kyle, a few months ago, and we may do that. I may have Kyle Christie on again. He's a good guy. I like Kyle, and I've been watching him on Instagram over the years since we first spoke, and he's really moved on in a positive manner. Excuse me. He's married. He's got a beautiful kid, beautiful wife, beautiful family, beautiful life going on, and so we'll see if we can get him on. Sergey, will you have Karai Erdogan on the show at some point? Maybe if the timing is tough, man. Turkey. It's a 10 hour. I forgot, 9 or 10 hour difference. And the fact that Dr. Bisher was on blows my mind. She's such a trooper. Maybe we'll have him. I haven't talked to him about it yet, but we'll see. Thoughts on Dr. Barghouti? I like, Dr. Barghouti. I haven't looked at his work. I did early on, several years ago. I don't remember being blown away. I'll just leave it at that. The disclaimer, several years ago, and I don't remember much about it. But I do know that he's the one that's doing that verteporfin study, or the spearheading it, which someone else asked me what I think of it. I think it's no. I'm not big on it. And I highly doubt that I'll be proven wrong. Adam B. Hey, Adam, do you think exhausting FUT first and moving to FUE last is the right approach for maximum grafts transplanted? It was for me. Norwood 6 plus. How many strips have I had? I had 2, 5, 6, 7. I think I've had 7 strips. Albeit one was a revision, and yeah, I think that's what it was. 10,000 grafts, plus or minus, probably plus, at a strip. And then I was able to have an FUE for 700 or 800 grafts. And I actually could have more FUT if I wanted to. I don't know if I would, but I think for a lot of patients, that is the case. It doesn't mean exhaust FUT. Like push it to the limit. I don't think that's the right approach, because the more times you go to have FUT, the higher the probability of a wide donor scar. It's the law of averages. But I think that one good one is a smart move. One big one, not too big, but big, like 4,000 grafts. That's a good number. Maybe two, depending on the circumstances. Obviously, the patient physiology. Excuse me, but I think that is the best way to get the most grafts for potential advanced Norwoods. I have no problem with all FUE cases. I've seen countless results where the proper management was used of the donor area, so great coverage was achieved. But I think FAT is valuable. I think it's unfortunately a dying art. It's not dead yet, but it's certainly on its way out, and I think that's unfortunate. What's the best scalp laxity you've ever seen, and how big a strip can you get from it? Okay, so final question, Milk Drinker. Best scalp laxity I've ever seen in general are from the Spaniards, and the largest strip I've ever seen was on a Spaniard, or maybe Italian, I forgot which. I think it was a Spaniard, and it was a 9,000 graft case, more than 9,000, but between 9 and 10,000 grafts. And donor scar turned out to be a non-issue. I saw him a year later when I was in Spain. Looked fantastic. Great result, great donor area. Couldn't ask for anything better. One of the best hair transplant results, especially in one pass, in history. So hope that answered your question. Oh, and the strip itself was over 3 centimeters wide. I think it was a 3.5 centimeter wide donor strip, which is insane. And he had plenty left. Like, it could have gone bigger, but we didn't. Anyway, okay, so that's it, everyone. I'm unplugging the phones. Thank you, Joe from New Jersey, for your call. I hope I was able to answer your questions. And thank you, everyone, for tuning in to watch today's edition of The Main Event with me, Joe Tillman. I will try to be back tomorrow, Wednesday, August 23rd. Until then, hit the like button, please, on this video. Show me that you appreciate me being here. And of course, if you're not subscribed, hit the subscribe button and ring the bell for all notifications so you're sure to be informed of when I'm on air next, or the next video I upload, whatever you prefer. So thanks for watching. See ya.